to this episode of Step Change Conversations, a series of interviews where we discuss the intersection between citizen science and modern research. Today we are joined by Professor Isabella Annesi-Maesano, who is a member of our Step Change Advisory Board, but is also Research Director at INSERM NIH and Professor of Environmental Epidemiology, and also serves as Deputy Director of Desbrest Institute of Epidemiology and Public Health. Thank you very much for joining us today, Isabella.
Thank you.
So just to begin with, doing a little bit of a background research on yourself, it seems that you've had quite a varied kind of background a little bit. So you started off by studying physics and then moving on to medicine and then public health. I was just wondering if you could describe a little bit about your journey to where you are now, I suppose.
Since the beginning, I was interested in understanding the diseases, why some diseases are increasing so much, and obviously in view of fine prevention. And I felt that to do that, it was important to be in possession of several tools, in particular strict, robust methodological tools. And these tools were, for me, present in physics. I make an example, which is to understand why diseases are increasing. You need to have a good assessment of the cases, good assessment of the potential causes, and physics, since ever, is the science of the assessment, and which unit, how to assess, how to improve the assessment. This is why I took that way, physics and then medicine, and at the end I was quite satisfied with my choice, because I reached what I thought it was important. And now, but this is more recent, is even more important, because I'm involved, I think we are going to say that, in the exposome, which is understanding the totality of exposure to which an individual has been exposed during his, her life. And to do that, you really need to assess well, in time and in space, the various exposure. And for that, having PhD in physics is useful, and is useful also in the dealing of mathematics, modeling, statistics, etc. On the other side, medicine is very important to assess the diseases, because you need to be sure that you are really dealing with the disease. And just to make another example, for example, we say all the time asthma. Asthma is more has to be called asthmas, because there are several kinds of asthma. You can have allergic asthma, non-allergic asthma, occupational asthma, etc. And thus, obviously, medicine is useful for that, because you need to define your case. What it, I mean, who is the center of your study?
I suppose it just kind of demonstrates the point of, well, with medicine and with epidemiology, it's more than just what you know in the lab. It's about the bigger picture, I suppose, and how these diseases spread. It's not just a small petri dish example. You need to know how people's lives impact each other and how these diseases spread, I suppose. It's a big picture sort of thing.
This is the exposome, because many diseases have increased. Overall, the chronic diseases, so to quote some, asthma, chronic obstructive pulmonary diseases, diabetes, some neurological diseases like Alzheimer or Parkinson, they are in a small part genetic. you need some background to have a disposition to develop the disease, but all the rest is due to the environment. And what we have done in the past decades, trying to find whether one factor was related to the increase of the disease, was not enough to explain what we were observing. Why? Because the environment is very rich, and then there are interactions among the factors that modulate the individual response, and then also that are in synergy to act. To make an example, for example, air pollution. We know now that air pollution is very bad for the health, but if you are having a healthy lifestyle, which means healthy diet, exercise, and that you avoid being exposed, your risk of suffering from the effect of air pollution are lower than in the case of someone that doesn't have such a behavior. So this is really needed to be taken into account to understand what are the real causes of the disease, and obviously to, in following the results, the findings, promote prevention. And because this is the final target of epidemiology, understanding disease in order to prevent them.
And I suppose recently with, well, we all know how COVID affected everyone, but moving even beyond COVID, the climate crisis, pollution, how we all live our lives, the way that diseases seem to be spread, it's not just the one-off cases anymore. It has more of a global or public health kind of, we need to communicate these issues in a more, like from a ground level rather than from like a individual case-by-case basis, I suppose. I'm just wondering if you talk about how these changes in public perception of quote-unquote wicked problems and these issues that that affect everyone a little bit has affected kind of the way we communicate or you do your research, I suppose.
This is, a difficult question, because in theory is exactly what you say. Communicating on that is not so easy, because you need to show that things happens. The fact that we have a COVID because of loss of biodiversity, because reduced, an increased susceptibility of people, frailty of people that suffer from the chronic disease. Actually, we know that people with chronic diseases were at higher risk of severe COVID. Okay, but another issue that on which I communicated a lot is that air pollution has an effect on COVID infection because pollution increase the probability to get the virus by the diminishing of the permeability of the mucosa. So irritation is not good for mucosa. When the mucosa, epithelium mucosa is inflamed, the virus, everything can enter easily. So this is one way to have more contamination. And we publish with colleagues here in France on that, showing that exactly when there were peaks of particulate matter, some days after we had the peaks of hospitalization for COVID in several towns in Europe. So this is a robust result. And on the other way, which is more complicated, there is also an effect of pollution on chronic diseases. And as I said before, people with chronic disease then are at higher risk of COVID. But we know the biology underneath, but it's complicated for this interview. So just let's keep in mind, this is once again this idea of exposome and One Health or planetary health. Everything is in contact, and then we need to understand, not looking at only one specific point, but with an overall overview of the situation. That's good for prevention, once again.
Mm-hmm. I suppose a lot of these driving issues have been slowly, incrementally getting more and more important, if that makes sense. So it started off like a tap running, like in a bath. It's not a big deal to begin with if you keep adding water to the sink, but at some point it's going to overflow, and perhaps we're getting to that point where all these small little additions are coming together to cause these, like the link between a habitat loss and global warming and the interconnectivity of people. It's just sort of driving up kind of these issues that are just making it more and more prevalent in the life in the world we live, I suppose.
Yeah, I mean, before I was mentioning this exposome concept, which is all the factors that with which people interact in their life. And it's easy to think about the specific environment, external, like pollution, radiation, water quality, etc. But as you are saying, there is also a more general exposome, which is climate changes, green spaces, gray spaces, urbanism, etc., etc., and even more complicated, all the socio-economical sphere. I mean, how people interact because of their condition, social condition, and this is really important and probably neglected. For example, in Europe, we don't work so much on inequalities, health and environmental inequalities, whereas in USA, this is becoming a very important topic. So just to say that we are everyone is surrounded by so many factors that interact, and in some way, sometimes in a passive way. So you cannot do anything to avoid the exposure. And here I think the participative science is really important, because at least to alert, to monitor, and to communicate with the other about risk. For some risk factors, it's very easy to do, is working well. Pollution, pollens, some biodiversity. We have some experience in France and was involved in some of these experiences. For example, in overall in air pollution, with people carrying a personal device, assessing in real time exposure to particulate matter and VOC, volatile organic compounds, which is another air pollutant, and all with GP, I mean the geolocalization and the time. So we can see to what everyone actually can see and can communicate to the others. Today I was there, and there was that, but it's more sophisticated than that, because we have the data on website, nobody's obliged to say I was too much exposed today. We know that there were high level of exposure. We are submitting a paper in which one person carried such a sample for 1 year, one complete year, in France and in Thailand. As you can imagine, for air pollution, Thailand is worse than France, but the surprise that even in France, the air quality standards that are recommended by WHO, World Health Organization, were exceeded several times. So, which means that there is a risk for people to be exposed too much, and then risk of a disease, several diseases, because we know now that pollution is bad for many organs, and so for many diseases.
It's really interesting that you mentioned before about the inequalities within the healthcare system and just sort of within societies in general, because one group of people might have better access to better healthcare, or they may be in a region that have more accessible resources to help tackle local air pollution, whereas other places may not. And it's a really interesting idea to think about how we might need a collective effort to try and solve these issues as a more public global health sort of situation, rather than individual spots of individual regions of kind of taking care of these sort of issues. And I just wanted to
Yes, I do. I really agree with you. The environmental inequalities are also very important. If you are poor, you live in places that are more polluted. You have a less good water. You have more noise. Everything is related. So health inequalities, but also environmental inequalities. And the cocktail is a bomb in some way. It's explosive, if I can say.
Yeah, I find that very interesting. And I suppose a big part of hopefully what we can do with participatory research and citizen science is including more people within these researches and getting more inputs from how to tackle and how these issues are affecting people in real life, and how to I don't know, make some real world solutions to problems that are becoming less and less theoretical now, I suppose. We
need to follow to what you are saying. We need to produce a lot of data showing that there are a relationship, because health is one thing, economy is another, and unfortunately the marriage is not easy. So economic interest sometimes prime on the rest, which is a stupid things, because in the long term, the health is very expensive. When I discuss with people, some institution or even the government, I see that they have a short view on we are losing that now on the economic point of view, but they never think that having lung cancer is very costly for the society, that lung cancer, for example, is due to the environment. Okay.
Can you talk a little bit about how you've used participatory science or citizen science practices within your own research, and perhaps give a few examples of how it's kind of impacted the outputs or results of like policy change, perhaps, or just sort of like, yes, it's nice to have citizen science within the research process, but it also how it's impacted kind of the outputs as a whole, I suppose.
So for the research process, we need, what I'm doing, I think it's good to talk about my own experience, my lab experience. We have, as I said, one volunteer carrying this remote sensor that we have developed. The name is Canaring for 1 year, but more consistent. We had some volunteers in Ile-de-France, which is the region around Paris, carrying for some 2 weeks twice per year. I don't remember exactly the schedule, but I mean, just to see how this worked. They were volunteers. So then we had all the assessment done and a description of the situation. And so and now I have some patient there. It's really interesting, a respiratory patient with a nasty disease, which name is pulmonary fibrosis, idiopathic pulmonary fibrosis, which is, idiopathic means we don't know the cause, but actually we know the cause. One cause is air pollution. So why is it interesting? They are carrying this small device. It's interesting because for them, there is an alert. We know that in this disease, being exposed to a sudden increase of pollution is not good. I'm not talking about a peak. I'm talking a sudden increasing of the pollution. And for them, this can be an alert. Don't go out because the pollution is going up. For you is bad, etc. So this, I think, is a first application saving a life, because if you have too much pollution, in this case of disease, sorry, you can have a loss of your lung function. Sorry to be technical, but this is not good, because when you go too low, you cannot come up anymore. And the low is bad for life, is a predictor of mortality. So you can see that this is a really crucial situation. So to sum up quickly, I think it's important having participants for monitoring, assessing, and then for adding also some alert, okay? And then you asked how to communicate on that. This is probably, we communicate, but I think it's a paradox. There is too much communication recently. So I'm not sure that our communication to the government, etc., is really effective. But what we have done in Cameroon, in Africa, putting some of these devices was retained by the mayor of the town as a useful tool for assessing air pollution, because they cannot have the classical monitoring station that are too much expensive, too much delicate. Also, they break so quickly, and you need to to fix, etc. Sorry. So they need to have some good tool, easy to use, etc. So.
And that's a really, just want to go back to the point you made about being too much information, I suppose. That's especially in the time we live in with infodemics and societal trust in research and the information that's available to the general public. And as a major part of the Step Change project, one of our CSIs is working with
the problem is not only, sorry, not only the public. You need to touch the government.
Mm-hmm.
Because if you want things to change, you have to go that direction. This is really difficult, you know.
Of course, yeah. If the government officials or the people who are setting these rules have incorrect information or incorrect assumptions, then that has a snowball effect that goes down to affects everyone, I suppose. And I suppose kind of the way that, yeah, Step Change is hoping to use citizen science in this area is trying to include people from all societal groups, so the quadruple helix, so the general public, policy writers, researchers, industry, and having
that's important, yeah.
and having them all contribute together to come up with good public health policy and advice for helping to try and ensure that everyone's on the same page when it comes to the advice they give, but also rebuilding these kind of bridges between these groups, I suppose. So you're not having the government saying one thing, other stakeholders saying another thing, and the general public who this affects directly, if there is another pandemic, not knowing what to do, I suppose. And I think, yeah, this interconnection between these groups is just quite important for developing effective public health practice, I suppose, and policy.
Yeah, researchers, public, industry, and government. I mean, I say government, for us here in Europe, it means also the European Commission, etc. So different levels. You can have a mayor doing well when the country president doesn't do the same. So yes, interaction among others, and it's needed to understand really the interest. And as I said previously, the long-term interest, not in the short term. This is not meaningful. I mean, it's a waste of time in some way.
I suppose that also links to what you were talking about before about how research can't be just siloed into medicine or physics or the environment. They're all interconnected, and the more we exploit the environment or reduce like deforestation or urbanization, the more the link between planetary health, public health, global health, I suppose.
Yeah, but that's for me, it's okay. It's a very important concept, but I don't see how to do it easily. This is why I have introduced, but I'm not alone, the concept of the avoidable exposome. Let's act on the risk factor that compose the exposome, on which we can have a rapid and effective action of a prevention. Diminishing air pollution is there. We know it works, it's good, etc. So before taking into account many complicated things like the biodiversity, how to protect it, etc., let's do step by step what can be done, like diminish air pollution, improving the quality of water, avoiding radiation, etc., etc. And I think it's important, because if we wait to have a full image to act, this will take several years, and it's not will not be conclusive in the short time.
And I suppose that's kind of another reason why projects such as Step Change, but it's not just Step Change, it's a lot of EU projects that are trying to work together, kind of transdisciplinary, I suppose, because we're working with conservationists in Slovenia, energy, like community energy projects in Germany, but also health, non-fatty liver disease in the UK, and disease outbreak in Italy. I think that's all of them. I don't think I've missed anyone, but yeah, trying to encourage these areas of research to maybe use more participatory or citizen science approaches, but also to build connections between, like, perhaps these, having kind of a relationship between our partners at Oxford University working in health and our partners in Slovenia at the University of Primorska, who are working in ecology, and then just building up these relationships, I suppose.
Yeah, I completely agree. Yes, I mean, everything is clear in the project, and we need to work together in interdisciplinary, putting interdisciplinarity together, and we will move slowly, probably. But,
and not to take up too much more of your time, but I wanted just to end on a bit.
I have to finish. Sorry, but I have to.
Perhaps if you've just got a quick moment, just end on a bit more of a positive. What excites you most about the research that you're doing, or like what positives do you see moving into the next few years in the future?
But sorry to have given the impression that I'm not positive. I'm positive.
No, don't worry.
When I bring up the idea of the avoidable exposome, I'm very positive because we are working on avoiding air pollution exposure for the patients, understanding what is bad for them. And so we advanced a lot in many ways. So I think really that prevention, major risk factor, air pollution. I insist because I work in Africa on water quality, and also so this is really something important to me.
And yeah, it's very easy for all of us to be a bit doom and gloom at the moment. So I just wanted to end on a slightly positive note. So thank you for that. And unless there's anything else you wanted to add very quickly,
no,
thank you very much for your time today.
It's me too. Thank you very much, Chris. Goodbye. Ciao, ciao.